So yeah, hello everyone. So yeah, we are discussing in the MCQs, and the MCQs are 6-year-old child presents with complains that she cannot see the board on ophthalmologic examination. She is found to have a 2 mm shortening of the LGL length of the eyeball. How much is the eye power will lead to? Yeah, okay, I'll repeat the question. It's a 6-year-old child who complains of that she cannot see a whiteboard clearly in school, and on ophthalmological examination she is found to have a 2 mm shortening of the axial length of the eyeball. So how much eye power will lead to this? And the options are 3D myopia, 6D myopia, 3D hypermetropia, or it's a 6D hypermetropia. Okay, just tell me what is the case? It's a hypermetropia or it's a hypermetropia? Basically there is a shortening of the 2 mm shortening of the axial length of the eyeball. So anyone can tell what is it? It's a hypermetropia or it's a myopia? 2 mm shortening of the axial length. Yeah. Okay, the answer is basically it's an answer is D here because there is a formula for this. But yeah, it's a case of hypermetropia. So in hypermetropia, it's a 1 mm shortening in the AP diameter will lead to 3 diopters of hypermetropia. Whereas if it's a curvature, it's a 1 mm increase in radius will lead to 6 diopters of hypermetropia. Next we have a question here. It's a ophthalmoscopy performed on a 14-year-old boy had a given incidental finding, and the family history is given that his grandfather had a colon cancer and his aunt was diagnosed as an endometrial carcinoma. So genetic test was done. It was confirmed that in genetic test it is APC gene positive. So which of the following is false about this condition? So basically you have to tell what a diagnosis first, otherwise you won't be able to tell. I'll just repeat. It's an ophthalmoscopy finding. Yeah, ophthalmoscopy finding basically it's a pigment in the retina is there. So pigmented retina is there in a 14-year-old boy which had a family history of grandfather with colon cancer, and his aunt was diagnosed with endometrial carcinoma, and genetic test was confirmed with APC gene positive. So what is your diagnosis, if anyone can tell? It's a familial, I think you can tell. Familial history. Anyone? Question. Rajkumar Verma. Yeah, okay. So yeah, anyone can what a diagnosis? And diagnosis here is, okay, I will only tell. The diagnosis is basically it is familial adenopolyposis is a diagnosis here. So yeah, now you can just tell if it's a case of familial adenomatous polyposis. So which of the following is false? And the options are: condition can be passed on to his daughter in the future. Second is mutation of the APC gene. What I told, it's on the chromosome 15. And third option is 100 to 10,000 of colonic polyps can be developed. And the fourth option here is prophylactic surgery is indicated. So which of the following is basically false in this case? It's a case of familial adenomatous polyposis. So yeah, it can be passed to his daughter on future because it's a familial case, and prophylactic surgery has to be done because it's cancerous. And the third option was, yeah, that also is right. It's more than 100 polyps will be seen in this case because it's a familial adenomatous polyposis. The second one is the wrong answer. That is the mutation of the APC gene is on chromosome 15. No, it's on chromosome number 5. So yeah, Rajkumar Verma, I don't know what is. He has just asking a question. Yeah, next question we have. The partial pressure of O2 in the alveolus is dash. It's 100, 45, 60 or it's 40. Just tell me what is the answer. What is the partial pressure of oxygen in the alveolus? Is 100, 45, 60 or 40? Just guess it if you don't know. Okay, it's 100. The partial pressure of O2 in alveolus is 100. So 100 is the right answer here. It's the partial pressure of O2 in the alveolus. Okay, next we have which is the most common type of vulvar cancer. Yeah, we discussed that in 2 days back only this question. Which is the most common type of vulvar cancer? And the options are squamous cell carcinoma, adenocarcinoma, basal cell carcinoma, or clear cell carcinoma. So yeah, if you can tell the answer. I only discussed 2 days back, I know the answer, but if you know the answer, what is the most common type of vulvar cancer? Squamous cell, adenocarcinoma, basal cell, or clear cell carcinoma? If you can answer this, it's an easy one. Yeah. So yeah, the answer is the answer is A here, that is a squamous cell carcinoma is the right answer. It's the most common type of vulvar cancer. So yeah, next question we have, it's hookworm infection in your locality. On investigation, it is found that the outbreak is the result of an open air defecation. So the district council decide to construct an RCA type of latrine in every household. So what is the optimum seal level required here? 5 centimeter, 3 centimeter, 2.5, or it's a 4 centimeter. Basically, there was the outbreak of hookworm, and you see that it's a result of open air defecation. So you provide toilets to them. So when you provide toilets, it's a RCA type of latrine in every household. So what is the optimum amount of water seal? 5 centimeter, 3 centimeter, or it's 2.5 centimeter, or it's 4 centimeter. Anyone can guess how much centimeter it is required for an optimal seal to be? Anyone? Okay, yeah, it's a PSM question. If you don't know, it's okay, but yeah, you have to learn that. So yeah, answer is 2.5 centimeter. That should be at least seal of 2.5 centimeter if you make it's a RCA type of latrine in every household at your toilet if you make. So it's a 2.5 centimeter optimum water seal is required. 5 centimeter. No, it's 2.5 centimeter. 2 to 2.5 centimeter for RCA. RCA is research cum action project. So yeah, 5 centimeter they haven't given. It's a 2 centimeter. Next we have a 65-year-old man who is a laborer presents with progressive weakness of the leg. He says that the weakness is more in the morning, and as the day progresses, it improves for a while usually. He is a non-smoker. Examination, you find there is a diminished tendon reflex in the lower limb. So which of the following statement is true regarding the condition? So yeah, if you can just tell a diagnosis from the condition. It's a 65-year-old laborer, progressive weakness of legs. He says that the weakness is more in the morning, and as the day progresses, it improves for a while. And he is a non-smoker. Examination, you see there is a deep tendon reflex in the lower limb. So which of the following is true regarding a condition? So yeah, if you can tell what is the diagnosis here first. Without diagnosis you won't tell. It's a syndrome basically. I also don't know this answer. Okay, the syndrome name, I can just tell what is syndrome. The syndrome is Lambert-Eaton myasthenic syndrome. Yeah, the given scenario is suggestive of Lambert-Eaton myasthenic syndrome. If you know what it is, you can tell the answer. The options are, which of the following is true regarding this syndrome? Options are, it's a depletion of presynaptic acetylcholine vesicles, or it's a no immunological involvement, or you can have it's a paraneoplastic syndrome seen in lung adenocarcinoma, or it's a incremental response on repetitive nerve stimulation. Basically, if you know it's a Lambert-Eaton myasthenic syndrome, I also don't know this. Basically, yeah, it's the answer to D. If you don't know, it's a incremental response will be seen on repeated nerve stimulation. So yeah, it's a neuromuscular degeneration disorder associated with a reduced acetylcholine release from the presynaptic nerve terminals despite a normal acetyl vesicles you have, but it will be released from there. So yeah, approximately 50% will have small cell carcinoma here. So yeah, D is the right answer. It's a Lambert-Eaton myasthenic syndrome. I will also learn this after this. Okay, next question we have, which of the following is the most important factor in reduction of diphtheria cases? Options are chemoprophylaxis, improved standard of living, vaccination, or it is an increased surveillance rates. I will repeat, which of the following is the most important factor in reduction of diphtheria cases in your society, or whatever you can tell. It's a chemoprophylaxis, improved standard of living, vaccination, or it's an increased surveillance rate. So yeah, anyone can tell. You can only tell, anyone can do it. Just tell me the answer. How will you reduce diphtheria cases in your society? Or it's by chemoprophylaxis, vaccination, improved standard, or it's an increased surveillance rate. So yeah. Okay, the answer is it's vaccination. Normally we have DPT vaccine, for diphtheria. So yeah, A chemoprophylaxis you don't give. For diphtheria you give what I know is vaccination only. They have also given that only. It's for DPT you give vaccination. No, it's no chemoprophylaxis, it's vaccination. For chemoprophylaxis what will you give? I have never heard for diphtheria you give a chemoprophylaxis. Maybe. Okay, I will check it out later. So yeah, its answer here is it's vaccination only. Next we have, it's a patient who presents with port wine stain over the face. and seizures are present. CT image is given below. What is the probable diagnosis? Okay. Okay, I'll tell you what is the CT image. Basically, it's a CT image is having, there is a calcification in the left hemisphere they have given. Yeah. So yeah, there is a calcification in the left hemisphere of the brain in CT, and you have the history of port wine stain over his face, and seizures are present. So what is the diagnosis you can tell? So the options are von Hippel-Lindau disease, neurofibromatosis 1, or it's a tuberous sclerosis, or it's a Sturge-Weber syndrome. So yeah, if you can tell. I'll just repeat it for last time. It is CT is showing there is a left hemisphere calcification, seizures are there, and you have port wine stain. So what is the diagnosis? Von Hippel-Lindau disease, neurofibromatosis 1, tuberous sclerosis, or it's a Sturge-Weber syndrome. So yeah, if you can tell. Okay, anyone can tell this? Okay, the answer here is D, that is the Sturge-Weber syndrome we are talking about. In Sturge-Weber syndrome only you will see the calcification that will be mainly in left hemisphere. And yeah, as I said, there will be port wine stain, and there will be seizures will be there. So it's a childhood seizures which are refractory, and other features we have mental retardation and focal neurological deficit will be showing. And the main important point is CT scan. CT scan will show subcortical calcification in a tram track pattern, which is a characteristic of this condition. No, it's not tuberous sclerosis, it's Sturge-Weber syndrome. Basically, in this case, you have to see the CT scan, and if you see there is a subcortical calcification in a tram track pattern, so yeah, you will see it's a Sturge-Weber syndrome. And port wine stain, you know, it's in many conditions you can see port wine stain also. So next question, it's Sturge-Weber. It's a easy one. This I think anyone can answer if you know. What is the lifespan of a platelet? 24 hours, 5 days, 7 days, or it's 2 weeks? Anyone? I think everyone can tell if you know. What is the lifespan of a platelet? 24 hours, 5 days, 7 days, or it's 2 weeks? Anyone? Lifespan of platelet. Okay, I will only tell it's 7 days. 1 week, basically 1 week is the lifespan of a platelet. 7 to 10 days, what you say? Yeah, it's what they have given is 7. The shelf life of a donor platelet is 5 days. It is stored at a special aggregator at a 20 to 24 degrees Celsius, and the half life is 3 to 5 days. So basically, it's 1 week. You can tell it's 7 to 10 days is the lifespan of a platelet, and you store it at, yeah, and this main important is in blood bank also you have this question. The main, at what temperature will you store it? You will store it at 20 to 24 degrees Celsius. Yeah, 7 days is the right answer. Next we have, it's a 6-year-old boy is there with a known case of sickle cell disease, presents with acute chest syndrome. So which of the following is a drug of choice to reduce such painful crisis in the future? And the options are hydrocodone, hydroxyurea, corticosteroids, or it's a ruxolitinib. So yeah, I will just repeat. It's a 6-year-old, and you have already diagnosed the patient as sickle cell disease, and he has a presence with acute chest syndrome. So which of the following is a drug of choice to reduce the painful crisis in future? Options are hydrocodone, hydroxyurea, corticosteroids, or it's ruxolitinib. Yeah, if you can answer. Usually it's a myelosuppressive agent. Anyone? Okay, now hydroxyurea. Yeah, hydroxyurea, right. Hydroxyurea is the right answer. Yeah, it's a myelosuppressive agent, and it is a drug of choice for reducing the painful crisis in sickle cell anemia. Yeah. See, in hydrocodone, the first option was opioid, and opioid was used in the treatment of pain crisis in sickle cell anemia. But yeah, it's the drug of choice is B only, hydroxyurea. And whereas corticosteroid is the first line therapy for acute idiopathic thrombocytopenic purpura, that is ITP. And the last word was ruxolitinib, and that is the drug of choice for polycythemia vera. So you have to remember all the drug of choice for this condition. Polycythemia vera, it is ruxolitinib. Corticosteroids is ITP. Hydroxyurea is basically you can give here, but drug of choice for this condition is hydroxyurea. Next we have which of the following is not included in the latest International Society of Urological Pathology reading of urothelial tumors? I will just repeat. Which of the following is not included in the latest International Society of Urological Pathology grading of urothelial tumors? And the options are urothelial papilloma, urothelial neoplasm of low malignant potential, it's a papillary urothelial carcinoma low grade, and the last option is papillary urothelial carcinoma grade 3. So I will just repeat, its options are urothelial papilloma, urothelial neoplasm of low malignant potential, papillary urothelial carcinoma low grade, or it's a papillary urothelial carcinoma grade 3. So yeah, if you can tell, it's a difficult one I think, but if you know then. Yeah, okay, the answer there is, its answer is D, that is papillary urothelial carcinoma grade 3. Basically it's not included in the latest guidelines, that is the International Society of Urological Pathology grading of urothelial tumors. So basically there are two grading, as you know, it's a WHO and that is the International Society of ISUP, you can tell. So yeah, basically in ISUP we have urothelial papilloma, urothelial neoplasm of low malignant potential, then we have papillary urothelial carcinoma low grade, and then it's a high grade. A is not the answer because A is included in the you can say ISUP. Yeah. But we use nowadays, we use ISUP only. WHO there would have a word classification, so we use this ISUP only. So yeah, the papillary urothelial carcinoma grade 3 we don't use because grade 3 was there in the old classification of WHO, not in the new classification. In new we have low grade, high grade, and low potential, and only papilloma. Next one, we have a patient is there who is brought to the OPD. He is in the state of euphoria. He was smiling and talking softly when he came in. Then he was quiet for a while. He then seemed to be excited and suddenly started to laugh for no reason. So how should the psychiatrist record the mood and affect? So the options are elevated mood and excited affect, euphoric mood and energetic affect, euphoric mood and restless affect, or it's an elevated mood and labile affect. So yeah, if you can tell the answer. It's a psychiatric question. He was smiling, he was in a state of euphoria, he was smiling and talking softly when he came in. Then he was quiet for a while, then he seemed to be excited and suddenly started laughing for no reason. So what is the mood as well as what is the effect? If you know, I have read it, you can tell. Elevated mood, excited effect, euphoric mood, energetic effect, euphoric mood, restless effect, and then we have a elevated mood and labile effect. Anyone? Anyone can tell? Okay, the answer is D. That is he has an elevated mood and labile effect. Elevated because when he comes to the OPD, then only can see he has a smiling and talking softly, whatever he has, he's in euphoria. B, euphoria. No, you cannot tell euphoric mood here. You can tell elevated mood and labile effect here. Because see, you can tell euphoric, but you cannot tell energetic effect here. That's why the option is elevated mood here. Elevated you can tell, and labile because excessive variation is there. Labile means it's a variation is there. He's just talking, he's sleeping, he's So you have to see both. You have to see the effect also, you have to see the mood also. So yeah, it's a elevated mood and labile effect is the right answer. Next one, you have what is the most common causative organism for Veruca vulgaris? I think we have discussed this. We have discussed in, I think 2 days back we have discussed this. So yeah, I will just repeat. What is the most common causative organism for Veruca vulgaris? Yeah. Okay. Just don't talk among yourselves. Okay, the question is, which is the most causative organism for Veruca vulgaris? And the options are HPV1, HPV2, that is human papilloma virus 1, 2, human papilloma virus 10, or it's a 2. So I will just repeat, what is the most common causative organism for Veruca vulgaris? And the options are HPV1, 3, 10, or 2. Anyone want to answer this? Let's guess it out. 1, 3, 10, 2. Also, yeah. Anyone? Okay, which is the most common causative organism for Veruca vulgaris? And it's HPV2 is the right answer. So yeah, you have to remember this. So it's a common warts, asymptomatic, and acanthosis, hyperkeratosis, and papillomatosis, and present as firm papules with a rough horny surface. So most commonly affected is HPV2 is the right answer. Most commonly affected in hands and fingers, and in children it is knees. Basically, I have to remember it's a Veruca vulgaris. Basically, it's a papillomatosis, acanthosis, hyperkeratosis, and yeah, HPV2 is the right answer. Next we have it's a biochemistry. This again calculation is there. If you know the formula, just tell the formula. So yeah, calculate the hepatic clearance of a drug with hepatic blood flow of 2000 ml per minute and hepatic absorption ratio of 0.5. Options are 4000 ml per minute, 2000 ml per minute, 1500 or it's 1000. So yeah, if you know the formula only, then you can tell. Again I will tell, it's hepatic clearance. You are telling the hepatic clearance of a drug with hepatic blood flow is 2000 ml per minute and hepatic absorption is 0.5. Now tell what is the clearance, if you can tell. What is the clearance of an organ? Is basically Q into E. Q is what and E is what, if you know. Anyone? Q is the organ blood flow and E is the absorption ratio. So yeah, if it is 2000 into 0.5, that is 1000 is the right answer. So you have to remember, for any organ there is a formula, that is clearance of organ equals to Q into E. Q is the blood flow to that organ, and E basically it's the absorption ratio, what is it abstracting. So yeah, the answer is Cl is equal to Q into E. So the answer is 100 here. Yeah, 100. So yeah, 2000 it was 1000, sorry, not 100. So yeah, next question we have, which of the following is considered a minor criteria for diagnosing fat embolism? And the options are subconjunctival petechiae, fat lobules in urine, FiO2 less than 0.4, or it's a CNS depression. So basically, which of the following is considered as a minor criteria for diagnosing of fat embolism? And the options are subconjunctival petechiae, fat lobules in urine, FiO2 less than 0.4, or it's a CNS depression. Anyone? Anyone if you can tell? Minor criteria. Okay, the answer here is, if no one wants to tell, the answer is B, that is fat lobules in urine is considered to be a minor criteria in case of fat embolism. So don't see, you see fat lobules but you don't repeat, please. Yeah. Okay, I'll just repeat once again. The question is, which of the following is considered to be a minor criteria for diagnosing a fat embolism? And the options were subconjunctival petechiae, fat lobules in the urine, FiO2 less than 0.4, and it's a CNS depression. So see, A is not the answer. A, what you said, is subconjunctival. Basically subconjunctival petechiae will be the major criteria, not the minor criteria. So we are talking here about minor criteria. So major criteria we have that subconjunctival petechiae, what is given in the question. Hypoxia, that is FiO2 less than 0.4 is also a major criteria, and CNS depression, and we have pulmonary edema is also major criteria. So yeah, the minor criteria is fat lobules in urine we have. And others also we have, that you have to remember. Tachycardia is there, pyrexia is there, emboli visible in retina, in urine, sputum, and all that. So at least one major criteria and 4 minor criteria are required to make a diagnosis of fat, that is a fat embolism syndrome. So next we have, it's a man found out that his wife is having a sexual relationship with the husband of one of her friends. Aggrieved, the man committed suicide by hanging himself. Upon investigation, the police found the suicide note wherein the man stated all the facts. Under which of the following IPC will be the wife be book? That is the IPC 497, 420, 306, or none of the above. I'll just repeat the question. It's a man who found that his wife is having a sexual relationship with the husband of one of her friends. So aggrieved, the man committed suicide by hanging himself. Upon investigation, the police found the suicide note wherein the man stated all the none of the above. No, it will be some IPC will be there. So yeah, okay, suicide note wherein the man stated all the facts. Under which of the following IPC can the wife be booked? IPC 497, 420, 306, none of the above. Okay, the answer that is not D, it is IPC 306. Basically, it's a abatement of suicide. Yeah, abatement of suicide, you can tell. It's, yeah, because the court noted that if an aggrieved spouse commits suicide because of life partner's adulterous relation, then if evidence produced, it would be treated as an abatement to suicide. So yeah, it's a 306, it's an abatement to suicide. Next we have, yeah, which of the following compounds does not give a positive reaction to Benedict test? And the options are ascorbic acid, monogenistic acid, sucrose, or lactose. So it's a biochemistry, if you can tell which of the following compounds does not give a positive reaction to a Benedict test. So options are ascorbic acid, homogenistic acid, sucrose or lactose. Benedict test, you have done in biochemistry in your lab only we do. It's for sugars, carbohydrates. Yeah, it's a test for reducing sugars. Yeah, I told the answer only. Which does not give a positive reaction. Yeah, anyone? Marrow bank question. Yeah, I'm using from there only. It's a marrow bank only. But how will I get the question? Yeah. Okay, the answer is C, that is sucrose, because sucrose is a non-reducing sugar. That's why C is the right answer. Because ascorbic acid and ascorbic acid, homogeneous and all that we don't use. Because the Benedict test is for basically reducing sugars, and sucrose is a non-reducing sugar. So yeah, its answer is C, that is sucrose is the right answer. Next we have, you are performing a CPR, and on a woman who is 38 weeks pregnant, she was admitted to the emergency after a massive pulmonary embolism, and which led to cardiopulmonary arrest. Despite the initial management of airway oxygenation and vasopressor support, there is no improvement. What is the cutoff time for perimortem cesarean delivery in this patient? 1 minute, 2 minutes, 5 minutes or 3 minutes? Basically it's a case of cardiac arrest, and it's a cardiopulmonary arrest. Despite all that what you do, there is no improvement. So what is the cutoff time for a perimortem cesarean delivery in this patient? Anyone? Because we have seen this in our OBG also, there is a cutoff time for this. If your patient is with, anyone would like to answer this? Okay, the answer is 5 minutes. 5 minutes is the cutoff time for a perimortem cesarean delivery according to AHA 2020 guidelines. Basically, it's for saving the life of the mother. It improves maternal survival by decreasing the compression of IVC by the gravid uterus. So yeah, basically it's for the mother only, and you do it within 5 minutes. You have to deliver the child, baby, that is. Next we have, again it's a long one. Okay. Next we have providing a basic resuscitation care to a newborn. After the initial management of airway oxygenation and IVSS, you perform a 12-lead ECG. And as the heart rate is 190 per minute. So what is the cutoff value to determine there is an increased QRS duration during according to the AHA 2020 guidelines for pediatric management of tachycardia with a pulse? Yeah, it's a long question, I know. I'll just repeat. You are resuscitating a newborn, and you do all the management, that is airway oxygenation and IV. You perform a ECG, that is a 12-lead ECG, and the heart rate is 190 per minute. So what is the cutoff to determine that there is a increased QRS duration according to AHA 2020 guidelines for pediatric management of tachycardia with a pulse? And the options are 0, that is greater than 0.11 seconds, greater than 0.10, greater than 0.9 or greater than 0.12. So if you don't know the answer, just tell me. Okay, I will only tell it's according to what they have done AHA 2020 guidelines for pediatric management. It's a greater than 0.09 seconds. So yeah, if you have a greater than 0.9 seconds of QRS duration, you can just tell it's a tachycardia. Yeah, it's a suggestive of possible ventricular tachycardia. So yeah, 0.09 is the right answer. So yeah, you have to remember this. There is no choice. Next we have, it's a 50-year-old man who comes to you with the complaints of hematuria and difficulty in urination for the past few weeks. So microscopic examination of urine sample shows there is a parasitic egg as shown in the image below. Which type of bladder carcinoma is the patient most likely to develop? So I will just tell what is basically what they have given in the microscopic image. Yeah, this again is the same thing. It's a repeated question. Basically it's a case of schistosomiasis. Yeah, it's schistosomiasis egg is there basically. Oval shape egg is there. Yeah, it's a case of schistosomiasis. So I'll just repeat the question. It's a 50-year-old, complaints of hematuria, difficulty in urination in the past few weeks. Microscopy shows schistosomiasis egg will be there. And what type of bladder carcinoma is the patient most likely to develop? And the options are transitional cell, squamous cell, adenocarcinoma, or it's a uroepithelial carcinoma. Anyone? Transitional cell, squamous cell, adenocarcinoma or it's a uroepithelial carcinoma. Okay, the answer is, so basically you have to know which condition will be associated with which condition. Like schistosomiasis will be associated with anyone? It's a squamous cell carcinoma. So yeah, it's associated with schistosomiasis. And what is so? It's the image was the oval shape egg was there. So yeah. Next question we have, it's a patient presented with history of multiple episodes of vomiting. So he was given an intravenous drug and later he developed abnormal movements. So which of the following can be used to treat him? So you have to diagnose this patient first. So your options are hyoscine, cryoheparin, levodopa, it's a Benzetazole. So I'll just repeat, it's a patient who has a multiple episodes of vomiting and he was given a drug, but because of drug he developed abnormal movements. So which of the following now can be used to treat him? Basically it's a drug induced something, we can tell what a diagnosis you want to tell. So yeah, anyone? Options are hyoscine, cryoheparin, levodopa, Benzetazole. Okay, so basically it's a adverse effect of an IV drug. Now you can tell. Okay, I will just tell once again. There is a multiple episodes of vomiting. You give a IV drug to the patient. After the IV drug, he is basically having abnormal movements. Basically, it's an adverse effect of some drug which you have given. So, what is the drug which will cause these abnormal movements? Is metoclopramide. So, to remember that first. And second, now how will you treat this patient with having the metoclopramide adverse effects? And the options what I told is hyoscine, cryoheparin, levodopa, Benzetazole. Anyone wants to answer this? Okay, basically I will only tell it's the answer is Benzetazole, because basically see, metoclopramide, what will we do? It's a dopamine receptor antagonist. So you have to give anticholinergic to basically it's a realize the effect. So yeah, it's an anticholinergic like Benzetazole can be given for this condition. So the answer is Benzetazole. Next we have, what is the value of endolymphatic potential? So anyone, what is the value of endolymphatic potential? Plus 80, minus 80, plus 20, or it's a minus 20. So yeah, endolymphatic potential, if you know, you have to remember this. It's okay, I will only tell it's a plus 80. So yeah, value of endolymphatic potential is plus 80. Okay, next we have a woman presents with you with hemiparesis due to spinal cord tumor. The doctor diagnosed this as a case of Brown-Sequard syndrome. So yeah, all are true about this syndrome except we will tell what is the wrong one about the Brown-Sequard syndrome. And the options are hemisection of spinal cord, ipsilateral loss of vibration sensation, ipsilateral loss of root touch sensation, or it's a ipsilateral paralysis below the level of fusion. So yeah, if you can tell Brown-Sequard syndrome. I know I am just speaking here. Anyone? A woman presented with hemiparesis due to spinal cord tumor and is diagnosed as Brown-Sequard syndrome. Okay, the answer is C. That is it's a ipsilateral loss of root touch sensation, because it's a clinical feature of Brown-Sequard syndrome. That is a ipsilateral loss of root touch sensation. So yeah, it's not seen in this. What is true except I'm just forgetting. It's not seen in this condition. It's a ipsilateral loss of root touch sensation is not seen in this condition. So yeah, what is Brown-Sequard syndrome? It's a hemisection of the spinal cord, and you will see all that condition. That is, there will be loss of vibration sensation, there will be paralysis below the level of the lesion. So yeah, Brown-Sequard syndrome, we have to remember this because it's a hemisection of the spinal cord. Next it's also a long question. So yeah, it's a 65-year-old patient with chronic fatigue and lymphadenopathy with presence to the OPD, and his peripheral smear shows the presence of smudge cells. Smudge cells is coming every day. I am on this second smudge cells case. Okay, I will just tell. Which of the following additional investigation will you do to arrive at a diagnosis? PCR, fluorescent in situ hybridization, flow cytometry, or it's a cytogenetics. So I will repeat once again. It's a 65-year-old patient with chronic fatigue and lymphadenopathy, and a presence to you with the peripheral smear. He has smudge cells. Which of the following additional investigation will you do to arrive at a diagnosis? So you have to tell a diagnosis here. If you know the diagnosis, you can just tell. Okay, whenever you have a smudge cell, just remember it's a CLL. Because last from 2-3 days I am seeing this question. If smudge cell is there, it is CLL. No, it is the right answer. I am that only. But yeah, it's a CLL. So if you have a smudge cell in the microscopy, you would think it is a CLL. And additional investigation, what you will do? It's not AML. AML no, CLL only. In smudge cell, it is CLL. Yeah, it's CLL only. Yeah. So yeah. When I was, what will you do is answer is flow cytometry. So flow cytometry is the additional test what you do with this condition to have a diagnosis of CLL. So yeah, basically you have to remember if it's a CLL, and you always remember it's a smudge cell will be cell in the microscopy, and you know it's a leukemia. So all that fatigue and lymphadenopathy will be there. So yeah, next question is the last question for today, and the question is, as a part of developing the public health policy on HIV in an African country, which of the following modes of transmission would you focus on the most? Options are parent to child transmission, heterosexual transmission, blood transmission, or it's a homosexual transmission. So yeah, I repeat, it's the last question. As a part of developing a public health policy on HIV in an African country, which of the following modes of transmission would you focus on the most? Options are parent to child, heterosexual transmission, blood transmission, or it's homosexual transmission. Anyone? Public health policy on HIV in an African country. Okay, the answer here is, if you don't know the answer here is B, that is heterosexual transmission. Basically, you will focus on the heterosexual transmission in HIV cases, that too in Africa country. Because heterosexual transmission is basically, it's basically HIV, and you know HIV, it's sexual transmission is the most common cause for that. So yeah, it's heterosexual transmission, which is the most common mode of transmission in developing countries such as Africa also, and India also. So yeah, we complete for the MCQ, we complete here. Yeah, thank you so much for joining.